My Medical Hub's physical score assessment is comprised of two phases. Phase 1 is in the form of an online questionnaire that the patient fills out prior to either the telemedicine or in-clinic encounter. So they're going to be answering a number of questions regarding their activities of daily living. The stuff they do every day puts stress and strain on their joints and ligaments, leads to overuse injuries. And they're going to answer a number of questions regarding medical history, family medical history. And then what we do is we do a deep dive on any kind of acute or chronic chief complaints that the patient might be suffering from. So we find out the frequency. Is this something that flares up every couple days, every couple weeks, every couple months? What type of pain is associated with the chief complaint? Is it dull pain? Is it sharp pain? Is it burning pain? Is there any tingling or numbness? We identify what kind of treatments, if any, the individual has tried to alleviate the issue. And then what we do is we'll ask on a scale of 1 to 10 what that pain is like. But one of the things, as you can see here, is we put descriptors on that pain scale. So if the patient says, my neck hurts and it's a level 5, they know that 5 means this is something I can no longer ignore. It's actually starting to impact my life. Now, I did mention that this assessment is done via telemedicine or in clinic. There is also a third way to do phase 2 of this assessment. And so that's using Emma. She's our efficient musculoskeletal management assistant. And I'm about to show you her in a little bit. She can walk a human through phase 2 of the assessment with no human intervention, and the provider would get the same report of findings had he done it himself. And so phase 2 of this assessment is where we will run this person through a number of different biometric movements, provocative tests, orthopedic special tests. The AI is going to be watching this person in real time. It's going to be measuring the ranges of motion. It's going to be flagging any kind of asymmetries in that range of motion. It's going to be flagging if any of these provocative tests or orthopedic special tests are triggering pain. And so what we'll do is, real quick, before we show you a provider-led phase 2 assessment, we're going to now show you Emma, our efficient musculoskeletal management assistant.
See the sample movement provided on your screen. Please stand facing the camera with your feet shoulder width apart and your arms at your sides. Tilt your left ear towards your left shoulder as far as you can. Then tilt your right ear towards your right shoulder as far as you can. It is extremely important to keep your nose pointed towards the camera. Try not to raise or shrug your shoulders while doing this movement. You will now have 5 seconds to position yourself in front of the camera.
Now, one thing I want to point out here is Walt doesn't have anything on, okay? He's not wearing any sensors.
Begin.
We don't need any specialized hardware, okay? This is a SaaS platform. Walt's just using a regular computer with a camera. If he wanted to, he could have used his cell phone.
Recording complete.
So after the different biometrics are completed, the patient's now going to be filling out a number of questions associated with that biometric. Once an individual completes their assessment, an assessment report is generated. Today's assessment report that we are looking at is a neck assessment. However, there are other body regions that can be done. The report begins with an assessment summary note. This is a brief overview of the patient's information that they filled out in their online questionnaire prior to performing the biometric phase of the assessment. The report then goes on to outline the different chief complaints that this patient identified on their body and the VAS score corresponding to that chief complaint. The report then goes on to show the postural screening. Posture screenings are done on every single assessment, whether it is a full body assessment or a simple body region. The posture assessment consists of 2 frames, the front posture and side posture. In this view, the system's looking at the individual's shoulders, hips, knees, and ankles and looking for any asymmetries in their stance. The side postural view is where the AI is going to determine whether or not this individual exhibits a forward head carriage or rounded shoulders. Based off of the AI's findings, this individual has no presentation of forward head carriage, rounded shoulders, scoliosis, kyphosis, or uneven hips. Overall, good posture. The report then goes on to lay out the different ranges of motion for this body region. Again, we are looking at a neck assessment. The system lays out what normal ranges are for a healthy individual in this column, and then in this column identifies the range of motion values for each of the biometrics that the patient went through. Any number or value listed in red indicates that the patient is hypomobile or deficient in a certain range of motion. The report then goes on to lay out the different special tests that the patient has gone throughout their assessment. In this case, the patient was negative for Lhermitte's test, a possible indicator of multiple sclerosis. The report then goes on to lay out each of the risk factors that the system has pinged or identified on this individual, and it is broken down from high, moderate, and low risk. Ideally, you would like to eliminate all of the high and moderate levels of risk for an individual over time. The report lays out a graphical representation, again, of high, medium, and low risks. the numbers that have been identified. It lays out possible care classifications or diagnoses that it thinks this patient is either trending towards or currently suffering from. A summary of positive findings. And then if severe enough, the AI generates a care plan. This care plan includes modalities, such as trying hot packs, cold packs, or TENS units, for example. It lays out short-term and long-term goals so the patient has things to aim for. Ergonomic considerations to maintain that good posture. And then this is the AI-generated care program that our system believes if this individual continues to do them, he can eliminate all of his high-risk factors.